building a better Bay Area for a safe and secure future. This is ABC 7 News.
Good afternoon. I'm Kristen Z. Welcome to our daily program called Getting Answers. Today, we'll take you live to both the San Francisco Zoo and at the same time to see what Governor Newsom's new order means for them. We'll also talk with a restaurant owner who has to once again close indoor dining because, as you've probably heard, we're going back to the past. Given rapidly increasing COVID cases, California is reinstituting a lot of the original stay-at-home restrictions. So let's run through the changes Governor Newsom announced starting today. All California counties must close indoor operations for these sectors: restaurants, wineries, movie theaters, family entertainment, zoos, museum, card rooms. Again, that's indoor closures, but all bars statewide must shut down. The rules are even stricter for the 31 counties currently on the state's watch list. In the Bay Area and Central Valley, that includes Contra Costa, Marin, Merced, Monterey, Napa, Solano, Sonoma, and Stanislaus. The governor did say Alameda County and other counties will likely be on this list soon. So these counties must also cease indoor operations for fitness centers and gyms, places of worship, offices for non-critical sectors, personal care services, hair salons, barbershops, and malls. So joining me to break all this down, infectious disease specialist with UCSF, Dr. Peter Chin Hong. Dr. Chin Hong, hope you had a good weekend, but the numbers to start the week, not good. You've been tracking the data, of course. Clearly, something in these numbers is deeply disturbing to the governor. So talk about it. What are they right now?
Well, I think we have the unenviable position of, coming up to the rates of Arizona, Texas, and Florida. And I think what the governor wants to do is nip it in the bud so that we don't get up to those places. And the most concerning thing in those three states of Arizona, Texas, and Florida isn't only the number of cases, it's the fact that the hospital systems are being overwhelmed right now.
Okay, but is California still one of the worst states in the country right now in terms of spread?
Yes, we're the top four, and that's not a position we'd like to be in.
There's so many numbers out there, and even those of us who look at them daily as part of our jobs get very confused. Tell us what to focus on. Which set in particular would say, hey, danger, danger here?
I would say there are three dangerous statistics to look at that are the most important. The first is test positivity rate. That's the number of people who are turning positive of the number of people who are being screened. So if that number goes above 8%, it's bad. Under 8% is good. But I must say there's a big range. So, for example, Alameda County isn't meeting that 8% range, but they have some other concerning statistics. So that's why they're kind of on the bubble. And that's why probably they weren't included in that sort of list of Napa, Sonoma, et cetera. The other statistic, the second statistic, is the number of hospitalizations and the number of available hospital beds. And the third statistic, which is the scariest one because it requires specialized staff, is the number of ICU beds available. So those are the three scariest to me, but there are a lot of other ones that the governor looks at as well.
Okay, so on those three measures, California not doing well, right? How about the Bay Area? Can we break it down to how we're doing here by those three metrics?
Yeah, so I would say in the Bay Area, there's a spectrum, and I think when Governor Newsom puts people on the watch list and not on the watch list, it kind of is an oversimplification. For example, Alameda, let's take Alameda again. They're kind of on the bubble, but if you compare it to Marin County and say test positivity rate, Marin County is almost double, if not more, than Alameda County. So a Marin is not an Alameda. And even Yuba County, because it doesn't have that many hospital beds or ICU beds, they're kind of getting close to capacity right now. So it's a spectrum. So one easier way to think about it is almost green, amber, and red. And in the Bay Area, we probably have like one main red area, which is Marin County, and the rest are amber. In the other parts of the state, we have like Imperial County and some parts around Central Valley, which are more red to amber.
Okay, why is San Mateo County doing so much better by the fact that they have more things that are open right now? What is the difference there? I mean, I think, Peter, this is the part that is confusing to people in the Bay Area. We look at it and we think, okay, we're all kind of on the same page with regard to wearing masks. We have similar demographics. We have similar policies. Why the huge differences?
That's really tough to explain. You know, one can say that San Francisco County is kind of spared, maybe because we have a generally older population than the other counties. We don't have as many kids running around, which may lead to other, you know, risk, for example, or multi-generation graduation parties or frat party sort of like outbreaks. But it's really tough to understand. So that's why they're looking at these, you know, metrics. And San Mateo County, just for whatever reason, hasn't risen to the top because their metrics are okay. That doesn't mean they're out of the woods either. And this is a very dynamic process. And I think that's why it makes people unsettled, because tomorrow you might wake up and you figure out in San Mateo County, you can't have the same freedoms that you had yesterday. So I think every day is a different day. And people, including myself, have to be psychologically ready for changes day by day.
All right. Well, even if you have some variances from county to county in terms of the numbers, does it not make sense from a policy perspective to still have the same rules? Because when you have different rules, then you might be saying, okay, inviting people from a different county to come to San Mateo County so that they can still get their nails done or hair cut. I mean, isn't there some type of need for uniformity when we're talking about one region?
Yes, there is definitely a need for uniformity. And I think Governor Newsom went one step in that direction by sort of making a blanket indoor non-essential statement with not, you know, with, you know, restaurants, for example, or movie theaters, but he also made a blanket ban on bars. So I think he's just trying to test the waters. And I don't think he'll be afraid to going back even further. You know, when Imperial County had its huge surge, they were actually under shelter in place for a while.
Yeah. No, this is true. I got to ask you, the particular rollbacks he announced today, do they seem to make sense, right, from the standpoint of those are the places where it's easy to transmit COVID to somebody else? So we're talking about no more indoor operations for restaurants, right, also for wineries, tasting rooms, movie theaters, family entertainment centers, card rooms. Does that make sense from a disease containment standpoint?
It makes partial sense. I think it's the obvious sense part, but I think a lot of contact tracer information or intelligence has shown us that much of the risk is invisible to the public because they happen on the inside in private homes. So big parties, 4th of July parties, when you're having people over, you know, that's not really seen and can't be controlled. So I worry about those a little bit more, but you know, that responsibility is on us to try and keep that quiet.
Now, the governor today was asked about school reopenings by some of the reporters. He said the state will be asserting itself in the days ahead. Not quite sure what that means, but he also did say that, you know, the decision is made school district by school district. That's the way our law is written. But today, LA and San Diego school districts announced that they're going to start the school with all distance learning remotely. From a medical standpoint, a scientific standpoint, given the trend, what do you think is likely to happen?
I think that California will make its decision despite what the federal government is saying. And it seems silly to make a blanket decision of the whole country when there's such different activities of disease happening. It's like going back to the past, like you said, Kristen. And could you imagine opening schools when we were surging? And that's, you know, it's hard to predict what will be happening next month, although people are not being optimistic. And it's hard to think that our schools will open to all in person, you know, federal dollars or not, if we have an epidemic surging in our state and in our counties.
So look, bottom line, we have about 30 seconds, but I got to ask you, looking at the numbers and what's happening in California, what can we each do here in the Bay Area?
I know it really seems simple, and I hope people aren't getting too fazed by the same message, but we do the things that we can get control of, which is to wear that mask, to wash your hands and to watch your distance and to really wear that mask everywhere and maybe get a new pattern or something and shake things up. But that's really the most important thing we can do individually.
All right, Dr. Peter Chin Hong, is always good to talk to you. Learn something every time. Let's keep this conversation going. I appreciate it. Take good care, okay?
Thanks. Thanks for having me on, Kristen.
All right, take care. Up next, we are pretty sure this hasn't been done before. We're going live at both the Oakland and San Francisco zoos at the same time to find out what these orders mean for them. We'll take a quick break on the air and be right back. All right, actually, Peter, I'm happy to say we can keep you for another 2 minutes. I didn't know that was going to be the case, so I'm excited about it. Can you run through a little bit of anything else we've learned with regard to, because I want to go back to, school reopenings, children and how much they could be carriers, even if they're asymptomatic, or whether they are truly proving to be, not that affected and fairly inert from a transmission standpoint. What do we know?
So what we know is that not all children are created equal. And so for some reason, kids below 10 are somewhat more protected, meaning that they haven't, when they did studies in Iceland of the entire population, for some reason they didn't find COVID detected in kids under 10. I mean, there have been instances in the US of people getting sick, but not in general. But the older you get as a kid, above 10 going into adolescence, the higher your chance of having asymptomatic spread and spreading it to your teachers or taking it home. So I think that's the epidemiology. There's also biology. They actually did some biopsies of kids who are under 10. The younger you are, the fewer receptors you have, ACE2 receptors, which the virus attaches to.
Mm-hmm. All right, well, that certainly gives us some hope that maybe the elementary school children will find their way back to school as long as they can find a way to protect the teachers. All right, thanks, Dr. Peter Chin Hong. See you again soon.
You're welcome. Bye.
All right, folks, next up on our program, we've got the two zoos joining us, and it's a tale of two zoos, in fact, because they're looking at very different situations. Oakland and San Francisco, as you know, San Francisco was allowed to open today, and Oakland has not been able to open. So we're going to take you there now. Eric, how long is this segment? Okay.
5, 4, 3.
Who? Who? All right, welcome back. Governor Gavin Newsom's orders today include the closure of indoor operations for zoos. Of course, many zoos have mainly outdoor operations. Now, San Francisco has been cautious and slow in reopening, but the zoo did reopen today. And so today we're going to take you live there to the zoo, foggy and all there on the coast, but that's how we like it here in San Francisco. Joining me, the Vice President of Philanthropy for the San Francisco Zoo, Tim Wu. How are you doing, Tim?
Doing great. How are you doing today?
Doing just fine. Got to ask you, how did the first day go? I guess it's not over yet, so how's it going?
It is amazing. The energy here is incredible. We have people coming through the zoo. Everyone is time ticketing, so we're socially distancing, but the people are thrilled. The animals are thrilled. We're having a great day, even in the cold and the fog.
That is excellent to hear. I want to know, are the visitors and staff seemingly adhering to the protocol? No problem at all?
We are having great adherence. We want to err on the side of safety. So from the moment you walk into the gates, we have social distancing signs that say keep 1 line's distance apart from people. We have contact areas covered. We have all of our indoor spaces closed. So we are basically an outdoor 100-acre private park for people right now.
Gotcha. All right. Well, I also want to bring in the lovely folks from the Oakland Zoo. Dr. Joel Parrott is the president of the Oakland Zoo. In fact, I see you got the sun there. You've got a gorgeous facility, yet you have not been allowed to reopen. Is that right? Are you getting any sort of indication when you might get the green light, Joel?
Well, we're really hopeful that, the Alameda County Public Health Department and the Alameda County Board of Supervisors have been very supportive. and we have they have a meeting to discuss this topic tomorrow morning, so that the public health department can apply for a variance from the state. So that's what our big day is now tomorrow, just to get the application moving forward to the state.
All right, I was going to say, I mean, the governor's orders today, they don't seem like they would necessarily affect you in the sense that, you know, he shut down indoor operations for the zoo, but just like San Francisco Zoo, basically everything you run is outdoors, right?
Yes, we've only have 2 buildings that are basically indoor exhibits. So it's really about being out on the pathways in the open air, being able to socially distance, having a mask on, staying with your family group. Those are the ways that we're going to be able to be safe and when the visitors come.
Look, I know you have a lot of people cheering for you. It's been a financial hardship, obviously, to not have the revenue. You know about the little girl, of course, in Castro Valley who's been making bracelets and raised over $100,000. So I know there's a lot of love for you. I also want to bring back San Francisco Zoo. And Tim, you know, how are the animals doing? And both of you can chime in, but in particular in San Francisco, since the animals haven't really been around people for a while, except for their trainers, and suddenly you have visitors and they're wearing masks, does it seem to scare the animals? Are they used to that?
I was just chatting with some of our animal wellness folks about that moments ago. When we closed, the animals were at first somewhat confused as to why there were no people here, and they got used to that. And now seeing people back, and they're very curious. We noticed that they're coming closer, they're checking people out. We got one of them yelling behind.
What is that, a lemur?
It's a peacock.
Okay.
Thrilled to see people, thrilled as we are to see them.
All right. Hey, do me a favor, Tim. Can you kind of spin around with your camera if you're mobile so we can kind of see, get the 360 view of the zoo, since I can't be there physically but wish I were. Give us a little tour.
Here are some of our giraffes. Can you see our giraffes coming by?
Yes. No, actually, yes, I see them now. You know what? It's our quality. I see their enclosure. Yes, I do see them. Ta-da! There they are.
There they are. Those are some of our giraffes who are checking out some of our visitors. I'm going to show you our visitors now. Here are a couple of our visitors waving to the giraffes. You can see them.
Okay, so it's, you know, I can see it's not very packed. What is the capacity that you're doing right now compared to normal?
So right now, we have about 1,700 people a day. Now that is compared to 6,000 people during a busy summer day. So we have permission to go up to 50% capacity, but we're being really safe and we're going below that just to ensure proper social distancing.
I gotcha. Okay, so today was just for members, I know. Tell us a little bit about when you open to the general public. And I know you're kind of doing this reservation system, so explain to people how they get one.
Of course. So yes, today and tomorrow are members only as a thank you to all of our members who stood by us during our closure. Starting Wednesday morning, we're open to the general public. Everything is timed, reservations ahead of time. You can go online to the zoo website, book a reservation time. Ticketing is completely touchless, so you show it to you when you come in, no contact, and then you just come in and you reserve a time. We can't wait to see you.
All right, sounds good. And Joel, I got to ask you, I know you've been tightening your belts from a staff standpoint for a while now. How much longer realistically can you go on without reopening?
They don't allow us to open. We have enough reserves to make it to about mid-December, and then we would be out of money completely.
And then at that point, we're talking about closing for good?
Well, you know what? That's where the city owns the zoo, and it's managed by a nonprofit organization called the Conservation Society of California. It's a nonprofit organization, and so when we run out of reserves, we just turn it back over to the city to manage. So Office of Parks and Recreation would have to manage it from that point on.
And gentlemen, you tell me, I mean, how important are the summer months normally to the operations of the zoo?
You know, for us, we basically, you know, we're very seasonal. So we have high attendance in the summer and low attendance in the winter. So we have to build up a summer reserve so that we can supplement the operation through the winter.
Yeah.
And then in the end of the year, it all averages out. So it's critical for us to be open in the summer because we won't have built up the reserve to make it so long.
All right, Dr. Joel Parrott, keep us posted on how your application for the variance goes in terms of being able to reopen. And Tim Wu with San Francisco Zoo, glad to see you back in business with everybody wearing their lovely, I want one of those San Francisco Zoo masks. It looks terrific. Good luck to you, both of you. Thanks for joining us.
Thank you. We'll get you one. Thank you.
Thanks. All right, folks, we'll take a short break on the air. When we come back, a local restaurant owner now has to pivot again, shut down indoor dining once again. We'll talk about the sweeping impact these new orders by Governor Newsom have on him and restaurants around the Bay Area. Be right back.
In commercial break.
Cool, cool. All right. Okay. All right, folks, lots of news to digest today. Governor Gavin Newsom looking at the COVID numbers in the state of California, pretty much roll back the clock and roll back a lot of reopened things. So once again, all indoor restaurant dining in the state has been shut down. And take a look, indoor operations closing for restaurants, wineries, movie theaters, family entertainment centers, zoos, although outdoor, okay, museums, card rooms, and bars. So no bars, not indoor, not outdoor, no bars. And then also for the 31 counties that are on this watch list, where the numbers are particularly alarming, they have additional restrictions. And those restrictions, I'll tell you about them in a second, but here are the local counties on that watch list. Contra Costa, Marin, Merced, Monterey, Napa, Solano, Sonoma, Stanislaus, and we understand Alameda and possibly Santa Clara will be added very soon. And you know Santa Clara just started their nail salons, hair salons, barbershops, and gyms today. So I'm not sure how long they'll be able to keep those open. But take a look. See, fitness centers, places of worship, offices for non-critical sectors, personal care services, hair salons, barbershops, malls, so indoor shopping as well, closing in the watch list counties, which make up 80% of the population of the state. So most people will, in fact, be affected in this way. All right, we are now going to come back on air and talk about what this means for restaurants.
7, 6, 5, 4, 3,
Okay.
2.
All right, welcome back. If you haven't heard the news, Governor Gavin Newsom rolled back a lot of the reopenings in the state of California, sending a lot of things back to the way things were when we first closed down. For example, indoor dining, that is gone for all of the state of California. Also shut down in terms of indoor operations, wineries, movie theaters, family entertainment centers, zoos, museums, card rooms, and all bars must close in California. In addition, there are some states that are on this watch list, and really it's not some states, it's most states. It's counties, 31 counties on the state's watch list at this point, and the local ones include Contra Costa, Marin, Merced, Monterey, Napa, Solano, Sonoma, and Stanislaus, with Alameda coming on likely soon, and possibly Santa Clara as well. So when you're on that watch list, it means you cannot have indoor operations for fitness centers, places of worship, offices for non-critical sectors, personal care services, hair salons and barbershops, and malls. Is our guest with us? Okay, we do have a guest coming because we want to talk about what this means for restaurants. In San Mateo County, one of the counties here in the Bay Area that had been doing the best and therefore had most things open, they were allowing restaurants to have both indoor and outdoor dining. Of course, that changes as of today with Governor Newsom's new order. So joining me now is the owner of Saj Mediterranean in downtown San Mateo to talk about the impact. Zayed Ayub, you started this business day being able to offer indoor dining at Saj, along with outdoor, of course. So the governor's order came down just after noontime. Did that immediately change things for you?
Thank you for having me on, Kristen. Actually, it did and it did not. It did in some of the counties that were open down south. In the San Mateo County, we actually decided to shut down the indoor dining as of July the 2nd. For the safety of our people and for our guests. The nice thing is we have really big outside dining areas. and thanks to the cities and the counties that work with us to reallocate the parking spots instead of in front of our locations to make them sit down. So it did and it did not at the same time, but we're all in this together. We're hoping to get through it together.
Hey, are you able to walk outside and show us your patio dining or your sidewalk dining that you're talking about? That's actually a pretty sizable area. I know this because I've been there, but I want to ask you while you're walking over there to show us, given so many people working from home, do you actually have much of a lunchtime business there downtown?
You know, we not as much as we would do have.
Okay, I guess you have to go back inside for the Wi-Fi, right? So that's cool. If you want to go inside, we can imagine.
But yes, our lunch business was impacted significantly, and we're really relying more on the to-go business and the online and the delivery business.
So how long were the indoor operations happening before they were shut down again, the indoor part?
In San Mateo County, roughly, I would say about a month where we had indoor dining. In other counties, they're not even open yet. Like Santa Clara didn't open, and we have some locations in LA that didn't open.
Got it. So even before the governor took action today, the county took action to say, let's phase out the indoor dining again. So you had it for about a month. How big of a portion of your business is that, the indoor part?
We're kind of lucky because of our offerings and our format. We're what we refer to as 50% off premise.
Okay. But when you have to do, every time you have to pivot, I'm so sorry, we're having some signal issues, but I just got to ask you, how long can you continue like this where you're constantly having to adapt and shift whenever an order comes down again, and then you might bring people back and then furlough people? Like, how long can you last like this?
It's very hard, Kristen. It's very, very hard. The good thing is we've kind of been through this before, so we know what to do from a protocol and health county guidelines. That's a good thing, but it's very hard to manage labor and staff and our team members. Luckily, we have a great staff, and we're really relying more on the online and the to-go and direct-to-consumer, so we're kind of offsetting the in-store with that.
All right. Zayed Ayub from Saj Mediterranean in San Mateo, thank you so much for joining us.
Thank you.
All right, take good care.
Thank you so much. Bye-bye.
All right. My producer saying something? Okay, we'll take a short break and be right back.
In break.
Thank you, Kristen.
Thank you. Take good care now. All right, folks, thanks for tuning in today. Just quick communication with my producer. Couldn't really hear what you were saying as I was saying goodbye on air with Zayed, but okay, great. Thanks for joining us today. Obviously, with these rollbacks, it's going to mean dramatic changes. A lot of the Bay Area counties hadn't advanced that far to start up indoor dining again anyway. But for many parts of the state, if you just venture out beyond the Bay Area a little bit, those restaurants have been operating, indoor museums, card rooms, family entertainment centers, all of that coming to an end. Movie theaters for now, as the state of California faces surging cases. And as Dr. Chin Hong told us, we're also talking about surging test positivity, right? Those numbers are going up as well, the percentage of tests that are coming back positive. Also hospitalizations and ICU bed availability. San Francisco had issued its own press conference with kind of a dire projection that we could have a peak of 6,000 hospitalizations before the end of the year if the trends don't change. And they have lots of different models, right, that are conservative or worst case, and the 6,000 figure is worst case, but still they don't want to go anywhere near that. Hence, they're going to continue to be cautious, and that also plays into exactly what Governor Newsom is saying too about needing to do these things so that California doesn't get in the kind of dire situation that there's no coming back from. All right, we're coming back on air. And Eric, you said we have 4 seconds? All right.
Back in 15. 10, 9, 8,
Thanks for joining us today. World News Tonight is next. All right, thank you, Facebook friends. Glad you tuned in today. Let's keep this conversation going. I'll see you tomorrow.